Pelvic Inflammatory Disease, commonly called as a PID, is an infection of the female reproductive system which includes the uterus, the fallopian tubes, and the ovaries. PID is a very common condition which we nearly always find in an ultrasound finding of a lady. What are the symptoms of a PID? PID often does not cause any obvious symptoms. Most symptoms are mild and may include one or more of the following, like pain around the pelvis or the lower abdomen, discomfort or pain during sexual contact that's felt deep inside the pelvis, pain when passing urine, bleeding between periods and after intercourse, heavy periods, painful periods, or an unusual vaginal discharge, especially when it is yellow, green, or smelly. A few people become very ill with severe pain in the lower abdomen, and that could be a great feature which is suggesting a severe PID. They may also have a high temperature. Now, when to seek a medical advice for this problem? It's important to visit a gynecologist if you experience any of the symptoms of PID. Delaying the treatment of a pelvic inflammatory disease can increase your risk of serious and long-term consequences. This could be infertility or a severity in which the infection could cause some more problems. Diagnosis is often based on your symptoms and the finding of tenderness during a vaginal examination once you visit a gynecologist. Swabs will be taken from your vagina and the cervix, but a negative swab does not mean that you might not be having a PID. What are the causes of PID? PID can be caused because of a bacterial infection that spread from the vagina or the cervix to the reproductive organs up there, like the uterus and the fallopian tubes. There are many different types of bacteria which can cause a PID. This could be bacteria which got transmitted by a sexually transmitted infection by a sexual contact, such as a chlamydia, a gonorrhea infection, or it could be a mycoplasma genitalium infection. In many other cases, it's caused by bacteria which are normally living in the vagina of the female, but when the immunity of the lady goes down, this might become serious. Now, coming to what is the treatment available for a PID. If diagnosed at an early stage, PID can be cured, can be treated by a course of simple antibiotics, which usually last for 14 days, and it is given generally when you visit a gynecologist. It's important to complete the whole course of the PID course so that you do not have a recurrence. You should also take some infection control procedures, like during the treatment you should not have any contact with a partner. Your recent sexual partner, your husband, should also be tested and treated to stop the infection coming back or being spread to others. What are the complications of PID? The fallopian tube can become blocked and scarred, and this might lead to infertility later on. This can cause increased chances of an ectopic pregnancy, that is, a pregnancy in the fallopian tubes, which is called an ectopic pregnancy. Some ladies with PID become infertile because of this infection. If you have a delayed treatment or had repeated episodes of PID, you are most likely to have a risk of infertility later on. But most people treated for PID are still able to get pregnant if they take a proper course of antibiotics written by a gynecologist. Now the question comes that how can we prevent a PID? We can prevent it by using a barrier method at the time of contact if we are not wanting a pregnancy. Having a single sexual partner is very important, and the partner should also be having only a single partner. Chlamydia is very common in young men and women, so take early treatment from a gynecologist if you notice some type of discomfort in your pelvis. So this is the method how you can prevent and treat a pelvic inflammatory disease. Thank you so much.